Good morning, everyone, and welcome to the Respect in Action webinar for November. My name's Katie Larson, pronouns she, they, and I'm the Senior Manager of Inclusion and Participation at Mind Australia, and really delighted to host this series that we run here at Mind, thinking about intersectional approaches to inclusion and how we achieve health equity and justice in our mental health services. Before we commence, I'd like to acknowledge the traditional custodians of all the lands that we're joining from today. I'm on Wurundjeri land, so I'd like to pay my particular respects to Wurundjeri elders past and present. I'd also like to, through our inclusion statement, recognise the experience and contribution of people of all genders, cultures, sexualities, abilities, spiritualities, ages, bodies and backgrounds, and recognise the value of lived and living experience of mental health challenges in the work that we do, and the courage, the skills and the value of the people who for those of us who work from that perspective, and how that contributes to change and human rights in mental health services. For those of you who haven't joined us before, please use the chat box to communicate any reflections that you have, but also to ask questions. I'll be introducing our guests today, and they will be doing a presentation for us, and so feel free to put questions in as we go through, and I'll be able to come back and ask those towards the end of the event. So contribute to the conversation as you see fit through the chat function. Today's event I'm really excited about because it goes to the heart of what we're trying to do with the Respect in Action series, which is think about intersectionality. And those of you who know me know I think about this a lot, and we talk about this a lot, and intersectionality is such a, I believe, a critical factor in us thinking through what it is to really reform and change the way we think about mental health, the way that we think about the way we provide services, and actually support each other and support different and really critical perspectives from come through in our work. I'm delighted to introduce today Budi Sudarto. They are the Director of Ananda Training and Consultancy, a boutique agency specialising in intersectionality, inclusion and justice. And Bertie joined us for the first time when we won the first ever of these events, which was an internal event here at Mind. And we were like, we've got this idea around a learning community, and Bertie was our first guest, and is such a profound thinker in this space. They provide training to agencies, including University of New England, Berry Street, City of Melton, and focuses on improving the existing diversity framework through an intersectional lens and decolonising practice. Bertie's stories have been featured in ABC, SBS and the Sydney Morning Herald, and they're currently working with the Australian GLBTIQA+ Multicultural Council, or AGMC, and RMI University to develop an LGBTIQA+ terminology guide in several languages, as well as conducting a research project on international students and sexual health at Monash University. In March this year, Budi was listed as one of the LinkedIn top 20 LGBTIQA+ voices in Australia, and couldn't agree more in terms of the contribution and the approach that Budi takes to really helping us to think through deeply what intersectionality is, why it's important, and also what the incredible value that it offers us in thinking through the work we do. So I'm delighted to welcome you here today. Budi, thanks so much, and I'll hand over to you to present to us about your key ideas and thinking around intersectionality.
Thank you so much for that introduction, Katie, and good to see you again. We had a coffee and chat pre-pandemic, and then we had a webinar during the pandemic, and now we are here again. It is coincidence that both Katie and I has a Monstera looking after our shoulder. Purely coincidence. We did not plan that at all. And before I start, I also want to acknowledge the traditional custodian of where I'm calling from. So I'm also calling from the land of the Wurundjeri people of the Kulin Nation, and like to pay my respects to the elders past and present, as well as emerging leaders in the community. So thank you so much for that great introduction. It's also to invite me back to talk about intersectionality. Now, we've been doing webinar for the past 2 years, and I am still struggling to share my screen and everything else. So hopefully this will work. Okay, great. Thank you. It is working. The only caveat is I can't actually see any of you, but that's completely fine. What I've been invited today is to talk about intersectionality in mental health. And I always have a very, very specific focus on multicultural and multi-faith LGBTQIA+ perspectives. And throughout this webinar, hopefully we can walk through the concept of intersectionality together, and also hear some stories and experiences of members of my community when it comes to intersectionality, but also accessing mental health services. I am still learning. I'm always going to learn. I have been challenged as much as I am challenging individuals and organizations. So my desire or my wish for today is to create a respectful learning environment for all of us as we are going on this journey of improving ourselves, improving our practices to really, what Katie said, really focus on this concept of equity, justice, and human rights. Now, I am hoping that this is going to work because this is the first time that I am doing Mentimeter. But before we start, I also want to acknowledge where I am coming from or my positionality. So I am gay, I am non-binary, my pronouns are they and he, I am a Muslim, and I came to Australia in 1998 as an international student. Please stop doing the math in your head. I am of a certain age, and I established the consultancy in 2017. And that consultancy, the agency started, or it came about from experiencing systemic discrimination, multiple marginalization in multiple settings, including in the workplace. So I have a lived experience of accessing counseling and mental health services. I'm not at the moment accessing mental health services, but in the future, I will be accessing that. And my positionality. So things that actually give me privileges include that I came from middle-class background. I'm tertiary educated. I have a university degree. My English language proficiency is okay. You can understand me. There are times when my English completely escaped me, but that's completely fine. It is part of my intersectionality. I'm very fortunate to have secure housing. I'm very fortunate to have relatively stable income, and that's who I am as a person. And all of this positionality influenced my understanding of who I am, but also the understanding of the social world and the community. Hopefully this exercise is going to work. So before we even explore the concept of intersectionality, I would like to invite everyone to reflect on their positionality. So Keegan has kindly offered their help to put the link in the chat. And if you can click on the link, please, and it will open up a new window or a new tab, and that will have, I will share the screen, what the screen looks like in a very second. And all I'm asking you to do, if you're looking at the picture of the wheel of power or privilege, if you can share the 3 characteristics where you are closer to the center, or where you are closer to power. Okay, let me try to share the screen with you. Hopefully it's going to work. So the screen will look like this from my end. Great. English, able-bodied, and white. Thank you. I have to keep refreshing it. I forgot. Citizen, able-bodied, yeah, white, heterosexual, able-bodied, great. Post-secondary, excellent, heterosexual, yeah, neurotypical, owns property, yeah. Wow, this is great. Just going to click refresh. So it will disappear. Hopefully it will show up again. This has been great. It works way better than I anticipated. Thank you so much, everyone. So I'm going to pause there, and I would like to thank you for sharing your characteristics that brings you closer to power. And the one in the largest fonts is actually the one that is shared quite a lot amongst all of you who are attending this webinar. So able-bodied, that's a American terms. We use non-disabled, being white, English language, being a citizen, heterosexual, post-secondary study, neurotypical, owns property. So those are the kind of characteristics that brings you closer to power. And I'm going to explain to you now why we are doing this positionality exercise. So the concept of positioning, see, my English just escaped me. The concept of positionality is actually exploring who we are as a person and where we sit within a systemic power structure. So of course, in Australian society, the power structure has been mostly controlled by individuals who are white, Anglo-European, cisgender, heterosexual, male, non-disabled, middle upper class background, neurotypical, and also people who have access to intergenerational wealth. And there's a lot more. When we look at the power, the wheel of power and privilege, we can see who we are and how our identity has been created or has been formed to fit with the model or to fit with the dominant power structure. So we are constantly being positioned, and we are constantly positioning and repositioning ourselves within this power structure. So you can see from the diagram there, the closer you are to the center, the more access you have to the social privileges, opportunities, as well as the more you are able to influence people in power. It is no surprise that the majority of our politicians are white male, because they exist in a system, in a political system that actually privileges white heterosexual male. It is also not surprising that people like me, people of color, are positioned outside of power or positioned at the margin of power, for the simple fact that we were born brown or black. Our positionality also changes over time. So as I'm going to share you a little bit of my story. So for a very long time, I considered myself as a cisgender man. So I'm actually closer to power. But I never actually felt comfortable identifying as a man. And I never really subscribed to the social standard of masculinity. So now I identify as non-binary. And as you can see from the wheel of privilege, I'm actually moving away from closer to power into the outskirts of power. It also depends on context. In Australia, I experienced multiple marginalization because of my intersectionality. But back home in Indonesia, I'm actually part of the racial majority. I'm part of the faith majority. So my intersectionality and my positionality changes depending on the context, depending on the community, and depending on the settings where I am at the time. So in these settings, I feel that I am closer to power, but I'm off to a different a different conference after this, and I will be positioned at the margin of power in that particular settings. How does it relate to mental health and mental health practice? we may not actually realize that our approach to mental health, our understanding of mental health, and how we interact with our clients has been influenced by our positionality. So I'm preaching to the converted. I'm aware of that. And I would like to remind you of the concept of reflexivity, reflexive practice, where we're actually acknowledging that we don't come as a neutral person when we deliver mental health services. All of us, including me, have been influenced by social cultural norms that exist in our society. So this concept of a person-centric approach without reflexivity is actually quite dangerous for people like me, because the practitioners will come not being aware of their own biases, stereotypes, and prejudices, and will make that instant, immediate judgment of who I am as a person based on my skin color, my gender expression and presentation, my financial status, and a lot more. Reflexivity is also acknowledging that in Australia, we have been conditioned to think about mental health from a Western lens and from a Western scientific discourse and from a Western understanding of mental health. I come from a culture and society that has our own interpretation of mental health. And yet, when I access mental health services, that conversation never brought up. The expectation is for me to conform and to assimilate to the Western model. So reflexive practice requires us to actually rethink our approach, especially when we're working with individuals from ethnic communities who intersect with LGBTIQA+ identities. And this is some of the way, and why are we talking about positionality before intersectionality? Is again for us to remind ourselves that we are a product of our society. Each one of us has our linkage to power, and each one of us have our own story about marginalization. By being reflexive and aware about who we are, it's easier for us to actually influence change and also make alteration to our practice. So we really truly focus on the person who is sitting in front of us or who are on the other side of the phone line, or someone where we are having a conversation with. Okay, so this is not going to work. I'm not going to do this because I'm supposed to have a different slides, but I forgot to do it. But just before I start, maybe one person would like to put it in the chat about your own positionality. What have you learned about yourself after we explore this concept of positionality? I just realized I can't actually see the chat. Sorry, Katie, Keegan, help.
I can see the chat. So you can't say that at all, Budi?
Not at the moment, no.
Okay, all right. So if everyone, yeah, if you can add comments in the chat, that would be great, and we'll just talk through some of them. So one here around a Western perspective.
Western perspective for mental health, yeah. That is such a big thing at the moment. How do we decolonize mental health thinking and mental health services? So we actually complementing of what we already know with a non-Western understanding of mental health and approach to treatment.
Lived experience as family.
Absolutely, yeah. Family is quite central to multicultural communities, to ethnic communities, and how do we capture that and how do we honor that connections?
Nice point here. My place on the wheel of power and privilege has changed quite a bit over time.
There is such a great reflection, and we have to be comfortable with that changes as well, because that changes is an indication that power is actually quite dynamic. It's not static. And now we can actually think about what can I do within my power to influence social change.
It's interesting, isn't it? I think it's even can change day to day or sometimes meeting to meeting, right? Like it depends on the context of who you're with and how you sit in different spaces.
Absolutely. And this is why I put forward positionality before intersectionality, because we have to be comfortable with owning power. We have to be comfortable with recognizing marginalization. So when we are moving in different contexts, we're not losing a sense of who we are, but we are actually using what we have within our power, again, to influence change and to make sure that there is equity and justice in everything that we do. And one more, I can see like a blip.
We've got two more. So there's another one. I'll give you both. So poor cultural knowledge and understanding. And then probably picking up on that point, the wheel of power highlighted positionality is much more intricate than perhaps we tend to think about on a daily basis.
Absolutely. And thank you so much for that. So we are not very good at acknowledging our power and privileges, and we are not very good at talking about it because power and privileges has been constructed as something that is negative. We tend to move away from it. We tend to say to people, oh, but I don't have privilege. When we look at wheel of power and privilege, we all do have it. So it's more about being comfortable with feeling uncomfortable. Now let's move on to intersectionality. So intersectionality comes from the social legal movement from the Black and African American feminist movement. So it explored the intersection of multiple marginalization as experienced by Black and African American women in United States. And Kimberly Crenshaw has been credited as the person who really coined the term intersectionality. So you can see there Kimberly's explanation of intersectionality. Where power collides with oppression, it interlocks and intersects. So we are not actually segregating marginalization. We are actually including all different types of marginalization as affecting our own understanding of who we are, our understanding of the world, as well as our health, well-being, and opportunities in life. And this is the diagram that Sylvia Duckworth and I have, I've given permission to use this when we talk about intersectionality. As you can see there, and this is just 12 of multiple marginalized identities or multiple marginalities. There are a lot more out there. And you can see at the center of the Venn diagram is actually a person that have to constantly navigate their identities, a person that constantly experiencing systemic, sociocultural, and interpersonal marginalization, and a person who constantly having to reframe, rethink, and reconsider their approach depending on the settings. And one thing that I want to highlight from the concept of intersectionality is the compounding impact. The compounding impact of experiencing multiple marginalization and how dangerous it is if a person do not receive services because the services don't understand the experiences of intersecting marginalization. So the compounding impact is something that may look like this. This is my version of intersectionality, looking at 5 main things that affect my well-being in Australia and overseas as well. So my first encounter of marginalization is mostly related to my gender expression and my gender identity. Again, I never felt comfortable with the idea of masculinity. I never actually truly subscribe to being presumed as a male. So since I was little, since I was a child, there's always questions. Do you want to be man or woman? Why do you act a certain way? Can you be more masculine? Can you just play like other boys? And so on. So the experiences around gender and gender-based violence is something that I carry with me even until now. And not many people know that I have anxiety over calling people, over picking up the phone, because since a young age, every time I spoke on the phone or every time I speak on the phone, people always inquire, what are you? Who are you? Are you a boy or a girl? If you're a boy, why do you sound like a woman? If you're or a girl, if you're, what's going on here? So not many people know that. And I'm just letting you know. So you are very privileged to know a little bit of information about me. When I become aware of my sexuality, that's when I experiencing homophobia. That's when I start to realize that I'm actually seen as the others, that I am not heterosexual. And then I have to deal with a lot of internalized stigma in association with my sexuality. Again, I didn't have to think about race and ethnicity when I was in Indonesia. Came to Australia in 1998, and racism is the first thing that I experienced. That people were actually quite condescending to me. That people just assume I had no idea what they were talking about. And people in some instances, people physically remove themselves when they saw me walking down the hall or somewhere towards the room. So racism was very prevalent back then. And I still think it still exists now. I'm also of a Muslim background. It's a majority religion in Indonesia. Over here, Islamophobia is something that I encountered almost a daily basis, even until now. After September 11, being yelled at, I'm a terrorist because of my faith and migration status as well. So if you will look back the wheel of privilege, I'm actually not a citizen of Australia. I'm documented, but I'm not a citizen. So I'm unable to influence or to exercise my right to vote, to determine who's going to be leading the state or the nation. And you can see some of the words, some of the things that people have said to me. And this is an example of microaggression. When people say to me, your English is perfect, they might mean well. They might want to compliment me. What a lot of people don't realize, it can actually be interpreted as microaggression. And that's because there's already an assumption being made that as someone who was born overseas, who is brown-skinned, that I wouldn't have a good grasp of the English language. So it recreated a sense of othering. And that's what microaggression looks like. We may not meant it, but to the receiver is actually confirming our position as the others, people who have been put at the margin. You can't be gay, Muslim, and non-binary. That's something that came up quite often. And it must be difficult to be gay and Muslim. Assumptions already being made without actually asking me. So how do you reconcile it? What's your strategies? And how do you sit comfortably when you have faith, sexuality, and gender all intersecting? And the last point, you can't tell me that I know nothing about discrimination. I've been discriminated too. This usually comes from people who are yet to build their sense of feeling comfortable with being uncomfortable. So when I talk about systemic discrimination, interpersonal marginalization, especially within the LGBTQIA+ communities, a lot of people turn around and say, but we know what it feels like to be discriminated. So what do you mean that we are also the perpetrator of discrimination? When we look at intersectionality, the wheel of power and privilege, you can start to see how easy it is for members of marginalized communities to marginalize people who do not fit with the dominant structure of whiteness, cis, and heteronormativity. If you don't like it, then leave. Someone actually make a comment on that on my Facebook page, and I blocked that person straight away. So this is just an example of intersectionality. And how does it differ to this concept of diversity? Diversity as a concept is actually created by members of the dominant group. It focuses on one specific factor or one specific characteristic as the problem. The tendency to homogenize entire community as having the same issue. And diversity is actually quite passive. The focus is about how do we make sure that people who are LGBTQIA and of ethnic community actually fit with our system, instead of thinking about how do we challenge, how do we change, what can we do to disturb the status quo, so people don't have to think twice about accessing our services. Intersectionality, on the other hand, comes from a Black African-American feminist movement, and it is an active word. It is an active concept. It requires us to constantly reflect and to constantly challenge the status quo. It requires us to constantly asking questions. What have we done to make sure that there's systemic change? And what have we done to make sure that people experiencing multiple marginalization feel safe, included, and that the service is for them? It's also about acknowledgement, again, that oppression and marginalizations are linked, interconnected, and my experience, as you see from my intersectionality, cannot be narrowed down to a single cause or problem, but it is the result of the intersections of multiple systemic marginalization. My identity is not the problem. It is the system that is a problem. Intersectionality requires us to question and challenge the system. And while I'm looking at the time, I'm going to ask you to read this for about 30 seconds, and I will verbally repeat the case study. The case study is about a non-binary young person of an ethnic minority and Christian background who is at risk of homelessness due to experiencing family violence regarding to their gender. English is their additional language. They are currently studying at TAFE and works at their local cafe. They started developing anxiety and depression due to their situations. They're on limited income and rely on public transport to commute. They live in the other suburb of Melbourne or Sydney or Brisbane or wherever you're calling from. And they find it difficult to keep an appointment because sometimes they were forbidden to leave the house or don't have enough money to pay for the fare. They cannot access telecounseling or telehealth because they still live at home. So they can't openly talk about their identity and their situation. If we look at the young person's experience from the diversity lens, there is a tendency for us to just zoom in on one factor. It's either their ethnicity or their gender, and sometimes it's not even about their gender. Everyone who are non-cisgender and non-heterosexual is just being clumped together as LGBTIQA+ or LGBTQIA+. And through my own experience, quite a few practitioners are actually reluctant to explore intersecting marginalities. So it's easier for practitioners to just focus on one identity. And as a result, it is at risk of stereotyping the whole entire community. And in this case, the risk of stereotyping all ethnic communities as inherently transphobic, recreating a sense of the othering. And the solutions often only focused on fixing one problem or one identity without the willingness to explore intersectionality and the experience of intersecting marginalities. Intersectional lens actually useful in this case study because it recognizes that the young person's well-being is a result of intersecting marginalization or intersecting marginalities. I keep confusing those two words. So it's the experience of marginalization based on race, gender, geographic location, English language proficiency, income, family dynamics, and more. So they are actually willing to work with the young person to explore how all these different parts of their identity intersect, collide, and influence their mental health and mental health outcome. So it's moving away from trying to identify a singular factor into exploring with the young person what kind of solution or strategies that can be implemented to keep them safe while they are navigating multiple settings, multiple communities, and also, if the young person wishes, maintaining connections to their family, their ethnic community, and their faith communities. The focus is on collaboration to make sure the young person is safe, multiple strategies as the young person have to navigate multiple settings and communities. And also moving away from seeing intersectionality as too complex, but to really embrace it. So the experiences of LGBTQIA+ with intersectionality is often the intersections between queerphobia, homophobia, biphobia, transphobia, with racism, ethnocentrism, faith-based discrimination, and a lot more. And AGMC did a survey. We got 95 survey respondents, and we also have focus groups. And what we found is quite a lot, more than half, actually didn't feel safe in LGBTQIA+ spaces because of the intersections between race, faith, and their LGBTQIA+ identities. 1 in 4 didn't feel safe in cultural spaces, but at the same time, they also feel a sense of connections. If we look at intersectionality as disconnections between multiple factors and identities, we can understand why. Cultural spaces affirm who they are from an ethnic and cultural background. At the same time, they must navigate homophobia, biphobia, and transphobia. Similar story in the faith communities, affirming in spirituality, at the same time having to navigate multiple layers of discrimination. And microaggression is very, very common. And mindful of time, so I'm just going to focus on the last point. For a lot of my peers, we have to continuously self-advocate just to access service. Self-advocacy requires us to relieve our trauma, including vicarious trauma. So vicarious trauma is a trauma that doesn't actually happen to us, but we heard it from our loved ones, from our peers, and we carry that burden with us. However, having to continuously self-advocate, we often don't see the required systemic change to make sure that we feel safe and to make sure that we don't have to relive our trauma over and over again. So this is a very important thing that I want you to take home today. What can we do to change the system? So people who comes to us, they don't have to over-explain, they don't have to self-advocate, but they can feel confidence that you will be able to honor their intersectionality. And this is what happened, feeling tired of having to constantly explain who we are. And the last paragraph, we just take it because we needed help. We needed access to services. And quite often we are emotionally and physically exhausted to then put on a complaint or even seek other mental health professionals. We needed help. And sadly, for a lot of us, that comes at the expense of experiencing microaggression from health professionals. But I want to finish off not from a deficit lens, and I got 5 minutes left, so hopefully I can go through this. I want us to think about intersectionality from a positive lens. And Monica Gabriel actually came up with this idea of positive intersectionality, where participants actually cherished and nurtured their multiple intersecting marginalities and see the uniqueness, see the positive and the strength that they carry to live day to day. And Segner Hamut Beckett, using this concept of intersectional narrative practice to explore how understanding intersectionality can be used. So the service users, the clients, the participants can identify their own strength and the joy and the love that comes from belonging to multiple marginalized communities. Segner worked with a lot of young queer people from Muslim backgrounds. So using this narrative practice actually has helped a lot of young queer Muslims to feel comfortable, to feel proud of their ethnic heritage, their faith, and also their queerness. Intersectionality is seen from a place of strength instead of a deficit. And I like this quote from a participant from Navigating Intersectionality. I stand on the intersections of my identity. Those are the anchors which give me the most joy, the identities that enrich my life. And being a complex human being, these are the communities, multiple communities, where I find home. There's such a complex richness of having more than one, being more than one of something. And that's something that I can personally relate to. I can affirm my faith in the Muslim community. I can affirm my identity, my ethnicity within the Indonesian community. And I can affirm my sexuality and my gender within the LGBTIQA+ communities. And what organizations like AGMC, Many Colored Skies, individuals such as myself, what we want to bring is the ability for people to affirm all aspects of their identities, whether it's faith, queer, LGBTIQA+, ethnicity, and a lot more, without feeling that they have to sacrifice one or the other. This is a little bit all over the place. So what can be done? Be reflexive. That's how we start the session. Understanding who we are and our own positionality. We see it as an opportunity for further improvement, to add to our existing knowledge and existing practices. We embed an intersectional lens when we are working with clients who are from ethnic background, who intersect with LGBTIQA+, who may intersect with neurodiversity, who might intersect with disability, and a lot more. So we embrace them. We've used the concept of positive intersectionality as part of healing. We have to feel comfortable with being uncomfortable because we don't know everything. And with every single client, with every single service user, with every single person that we're having a conversation with, it adds richness to our understanding of the world. And lastly is to be willing to be an agent of change. An agent of change to ourselves, again, by feeling uncomfortable because we hold power and privilege, and use that power and privilege, use our connections to people who hold power to influence meaningful change, and to bring people experiencing intersecting marginalities, give them the platform so systemic, meaningful, and sustainable change can happen, so the next generation won't have to go through the same trauma and the same difficulties that we are experiencing right now. And I'd like to read you this quote. We don't want your pity. We don't want you to feel sorry for us. And we really don't want you to rescue us. Make the changes that needed to be made from a systemic, interpersonal, and intrapersonal, so we can be safe and free from fear and discrimination. For our diverse intersectional identities to be embraced and valued, and for our dignity and human rights to be put at the center of everything that we do. There will be resources there. I can send this to Katie and to Kian after this, and I am on time for once. Thank you so much for listening to the webinar.
Fabulous. Thanks, Budi. That was remarkably to time. Incredible. So we've got a few questions coming through. I just wanted to start by saying thank you so much for sharing about your own lived experience as part of that. I think it's such a valuable and critical part of understanding this work, is to understand the personal in relation to the political and the cultural. So I just wanted to acknowledge that firstly. So I have some questions, but there's a range coming through. So I'll go to the chat, and anyone who, if you do have questions, we've got about just under 15 minutes to talk through these. So we've got plenty of time, I think. So a comment and a question from Ravi. Comment, this is really helpful. Thanks. I found this quote from Amir Srinivasan helpful too. The central insight of intersectionality is that any liberation movement, feminism, anti-racism, the labour movement, that focuses only on what all members of the relevant group, women, people of colour, the working class, have in common, is a movement that will best serve those members of the group who are least oppressed. So from that, a question, keeping this in mind and assuming that it is valid, how do we use this insight to ensure that the most marginalised peoples are served better?
Thank you so much for that question, Rafi. My answer to that is put us at the center. Quite often we've been called in after the system has been created. Quite often we've been asked to review whilst everything is already in place. And I keep saying this to a lot of people. If we put people intersectionality at the center, everyone is benefiting from it. Because in order for us to understand intersectionality, let's say from LGBTQIA+, from ethnic and faith backgrounds, in order to make sure that the services cater for us, we do have to learn about LGBTQIA+. We do have to learn about ethnic diversity, faith diversity. We have to learn about disability. We have to learn about neurodiversity. We have to learn a lot more. So putting us at the center actually benefiting everyone. It should disturb the status quo. And as that quote that you shared with us, is actually taking the power away from people who are less oppressed to giving power to people who are often overlooked and denied basic human rights. And everyone's going to learn about human rights, and everyone will be able to improve as we all take on the journey. So that will be my answer to that. I hope that makes sense.
Yeah, definitely. Thanks, Budi. So there is a question about whether the slides will be available. So no pressure to answer that now, but we will send out the recording at the end of this. And if Budi's happy to share the slides, they can be included with that too. Lots of thank yous and gratitude and learning. Oh, okay. So this is a great question from May, because I noticed this too. In my work, I find that the government confuses diversity with intersectionality and end up with activities where people have to identify as either or, i.e. in the LGBTIQ group or the young person group or the called group, and we end up with siloed engagement. How do we push back on this?
Oh yes, I've seen quite a few government strategies that says we embrace intersectionality and we want you to deliver service where mental health intersect with. Dot 1, LGBTQIA+. Dot 2, cultural and linguistically diverse, which by the way, I don't like to use that. Dot 3, young people. Dot 4, women. Dot 5, asylum seekers. The pushback is to actually say, maybe we just need to have a line that says the intersections between two or more of the characteristics below. So LGBTIQA+ intersect with seeking asylum, intersect with disability, intersect with youth. So that's the pushback that we can actually ask the government. Have we considered all these things that you listed? Have we considered the intersections between all of them or some of them? And what can we do to ensure that services are actually actively working towards embracing, recognizing, and working with the intersection of those 2, 3, 4, or 5 of those. And so that breaks down the siloed approach.
Fabulous. Thanks, Budi. Question from Tim. In addition to centralising intersectional voices, what are some simple steps we can take to move away from emphasising diversity in organisations and start emphasising intersectionality as a means to implement genuine change?
Oh, there's no quick answer to that. So let me just rephrase it in my own head for a second. So a lot of people have diversity and inclusion strategies. A lot of organizations have diversity and inclusion portfolio. And when we really look into who's benefiting from that diversity strategies, again, it actually benefiting people who fit or who are closer to the power hierarchy. If we look at the wheel of power and privileges. So in LGBTQIA+ space, a lot of diversity and inclusion strategies are actually benefiting white, cisgender, male, gay, non-disabled, neurotypical. A lot of people who are not identifying with those identities are actually sitting outside of the LGBTQIA+ inclusion strategies. So if you are working with diversity inclusion strategies at the moment, keep asking those questions. Who are benefiting the most? And who do we need to bring in? And how can we change the system? So when we bring people in, they feel safe, they feel valued, their opinions, lived experiences, and expertise are heard to make meaningful change. So sorry if that's a bit too long-winded, but that's the best that I can say at the moment.
Fabulous. Thanks, Budi. We've still got time for more questions. So that was great, says Tim. So feel free to bring them through on the chat. So from Melissa, very helpful and clear answers, Budi. Thank you. I think people in management sometimes struggle to see this, how co-production helps everyone in the long term by elevating voice and needs of those most impacted by systemic failures. The failures are then in stark relief. Really energizing to work that way. Love how you highlighted how active this is. What do you say when people say it takes longer to work this way? Which happens all the time.
Oh yes, diversity and inclusion takes a lifetime to actually make a proper change. A key aspect of intersectionality is a lifelong commitment. You know, it is tiring. If you're a member of the majority group and you feel tired, imagine how we feel every single day. Getting up of the bed is tiring for us. And I often have this when I woke up in the morning and I'm thinking to myself, what am I going to confront today? And what do I need to do so I can start my day feeling good, feeling strengthened, feeling resilient, so I can face the day head on. If you don't have to think that way, congratulations, you're a part of the dominant group. You're close to the power hierarchy. Now is the invitation for people who are closer to the power to actually turn around to people and say, hey, look, it is a long process. We're going to make mistakes along the process, but think about who's going to benefit if we properly invest in this. And again, feel free to borrow my line. If we're feeling tired, imagine how the communities are feeling. So what can we do so they don't feel tired, so they feel energized, empowered, and they feel that they can make an active contribution to systemic change?
So thanks, Budi. From Ravi, agree that structural change requires a lot of patience. How do you develop or cultivate such patience?
Look, you know, without resorting to AOD, I can only share you how I managed to do it personally. Really think about the work that I do, not to benefit me directly, but really think about the people and the communities who are going to benefit the most from the work that I do. And that's, for me, is something that gives me strength. It pains me when people come to me and they are still experiencing systemic barrier and systemic challenges, systemic inequities. It does pain me. but I'll use it as a motivator to keep doing what I do. I am not invited to a lot of board meetings because of that very reason. I keep challenging them to do better. But for the people who are listening, willing to listen, willing to reflect, willing to change, including all of you here today, that's where I start seeing small changes. And please do not underestimate the smallest change that you can make. For the receiver of the service, it can save their life. So please keep persisting, keep doing, and just keep remembering. There are people who are benefiting from the work that you do. Get together with people who share the same vision and the same values and really draw strength from each other.
Beautiful advice. Thanks, Budi. We've got a couple more minutes. I've just got one question, and I wanted to just pick up on something you said in your last response. You said you don't get invited to a lot of board meetings because you're challenging people and ways of doing. And I think this is a really important point around how decisions are made and who gets privileged into positions of leadership and what we understand and kind of have bias around in terms of what leadership looks like, sounds like, you know, all of those things. So I wondered if you had any kind of, you know, we've got we'll have people on this in this call who are trying to do that challenge at that level. We'll have people who are sitting at that level. We'll have people doing both. Just any advice, I suppose, to support an understanding that challenge is about creating change, and that challenge is actually really critical, and that discomfort is actually critical, because I think that's, you know, you sort of, it feels like this work it goes smoothly while everyone's feeling good about themselves, and the moment it gets hard, someone's a problem, or they're difficult, or, you know, there's something else to focus on. And I just wondered if you had any reflections on that.
When I do get invited, I always ask them to return to their core values. Where do you see diversity, inclusion? Where do you see equity and human rights? Where do you see justice as part of your core organizational values? If it is stated in your values, then I'm wondering what are some of the barriers that actually prevent you from honoring the values that you have written down in black and white. Asking those simple questions and asking those simple wondering can actually initiate discussions about, I actually don't feel comfortable, I don't have enough knowledge about this, it challenges my own position, you know, I don't have enough skills to do this work. And from that moment on, it's actually opening a door for us to really bring people on board. If you don't feel that you have enough knowledge about this, let's explore this concept. You know, let's bring people in who actually have enough knowledge and who can actually guide us through making the systemic change. So that is probably one of the key things. Return to the organizational values, organizational mission statement, and really ask for that accountability. If we dare to project it to the wider audience, what can we do to honor it?
Love it. Thanks, Budi. What a great way to finish up the discussion today. Thank you so much for being here, for sharing your wisdom and your work and yourself. Thank you to everyone who's joined us for the discussion today and contributed comments or just taken the time to reflect and think through what we can all do to support this work. This is our last Respect in Action webinar for the year. It's been fantastic to have them as a sector-wide event this year, and thanks to all of you for your support. We'll send through the recording as always. Please share through your networks, and we'll be back next year with another series of discussions exploring intersectional inclusion. Have a fantastic rest of your day, everyone, and thanks again to Budi.
Thanks, everyone. Take care.